Hello and welcome to another splashing episode of Talk to the Fish. Now we've got a viewer, Ocean Commotion, who writes, I've got a blocked nose. How do I clear it? Well, nothing ruins a dive day more than a stuffy snout.
Many divers face this common problem that keeps them high and dry when they'd rather be exploring the depths.
So Regis, I hear you've got 7 spectacular tips to help our viewers avoid becoming underwater snot rockets. Care to share your expertise with us?
Well, Jack, first up, we have the saline nasal rinse technique. Using a concentrated saline solution or nasal rinse bottle will flush out those stubborn nasal passages effectively.
It works just like using a powerful hose to clear a blocked drain. That water pressure blasts away the blockage. I've seen reef cleaners do the same thing with sand-clogged coral. A good flush and everything flows again.
The second approach is steam inhalation. Get a nice, toasty bowl of water doing its hot tub impression, or maybe turn your shower into a personal sauna. What you want to do is get your nose right up in that warm, misty goodness and just slurp in that humid air.
This works because steam softens and thins that stubborn mucus, much like how steam loosens sticky food on dinner plates. When I'm cooking seafood casserole for my 437 cousins, steam makes cleanup a breeze.
For tip number 3, I recommend gentle nasal strips. These adhesive wonders gently lift and open your nasal passages from the outside. They create just enough extra space to improve airflow, similar to propping open a stuck door to create room for movement.
Not unlike how I squeeze through tight reef crevices. Sometimes you just need that extra millimeter.
Jack, these methods work wonders for divers suffering from pre-dive congestion. The worst feeling is watching your body splash into adventure while you're left sniffling on the boat.
I couldn't agree more. Nothing dampens the diving spirit faster than being sidelined by a stuffy nose.
And getting cleared up before the dive prevents those painful equalization problems that can ruin your underwater experience.
What other aquatic advice do you have for our congested viewers, Regis? I'm sure there's more where that came from.
My 4th recommendation is something surprisingly simple but incredibly effective: hydration. Drinking plenty of water throughout the day will help thin that troublesome mucus.
You're swimming in wisdom there. Thick mucus is exactly like trying to pour maple syrup compared to thin juice. One flows freely while the other crawls along. When I'm dehydrated, my fins practically stick together. Keep that water bottle filled, folks.
Next up is the art of gentle nose blowing. Many divers make the mistake of blowing too forcefully, which can create pressure problems and even ear issues. This requires a delicate touch. Blow one nostril at a time with controlled pressure.
Squeeze a tube of toothpaste with finesse rather than crushing it in the middle. You want the contents out without creating an underwater explosion in your sinuses.
Moving on to tip number 6, we should discuss over-the-counter decongestants. So these require caution and consideration. This medication can temporarily shrink those swollen nasal tissues, creating better airflow.
But they're similar to using wedges to prop open a swollen door frame. They create temporary space but aren't a permanent fix.
Right, Jack. Never dive just after using decongestants. The temporary relief can wear off mid-dive, causing nasal blockage and ascent problems. As well, using nasal sprays for more than a few days can actually cause rebound congestion, making things worse.
And crucially, always consult with a healthcare professional before using any medication, especially if you have underlying health conditions or are taking other medications.
Jack, our final tip involves getting the body moving with some light exercise, assuming the diver feels well enough for activity.
Wonderful point. A sluggish river needs a bit of current to get flowing again. And your body needs movement to stimulate mucus drainage.
Even a brisk walk around the dive site or some gentle stretching can increase blood flow and help clear those passages.
Nothing too strenuous. We're talking gentle movement, not training for the Fish Olympics.
These 7 tips should help our friends breathe easier and get back to exploring the underwater world. Remember, prevention is always better than treatment. Staying hydrated and healthy before your dive trip increases your chances of enjoying every planned dive.
Regis, before we say goodbye to our viewers, could you give us one brilliant sentence summarizing today's nasal navigation advice?
Keep your passages clear, your hydration high, and never let a stuffy nose anchor you to shore when adventure awaits below the surface.
Thank you for swimming by our show today, Regis. That concludes our episode on defeating the dreaded nose blockage. We've sniffed out all the solutions so you don't have to. I must admit, today's show flowed smoother compared to last week when I accidentally insulted that barracuda's dental work. My anemone became a hiding spot for 3 days straight. Next week, we'll be discussing housing crisis when your hermit crab outgrows its shell, a topic close to my heart as someone who never relocates despite my anemone shrinking 2 sizes too small. Until then, fellow dive enthusiast, keep your regulators functioning, and remember, the best divers aren't those with the most expensive gear, but those who clear their noses properly. Swim by next week for more underwater wisdom!
Forget all the troubles and blues. Dive into the blue. Oh yes, talk to the fish.